the whole premise of prevention is to promote positive behaviors and to manage or eliminate negative behaviors. So how do we do that? So there is also kind of a process there, and it begins with knowledge and education. Okay, so it's part of what we call our health literacy model. So the first level is, and I'll use a blood pressure as an example. So the knowledge, so I understand why blood pressure is important and that I need to take my blood pressure every day, for example. Okay. The next level then is numeracy, which is applying the number to that. So, okay, I understand why blood pressure is important, but do I understand the numbers? And so I can read a blood pressure and know that what range it's in, or know what to do with that information. That really leads to the third level, which is navigation. So what do I do with this information? So if my blood pressure is sky high, let's say it's even in a hypertensive crisis zone, do I know what to do? So let's say it's 200 over 120. So should I call my doctor? Should I dial 911? Should I relax and hope it goes away? So understanding that information, in the case of blood pressure, you would actually wait 5 minutes, retest, and if it's still that elevated, you would dial 911. The next level is communication. So do I know what information to share with my doctor and what questions to ask? A lot of times, I hear physicians say, "Oh, if I had only known, if you had only shared that information with me that you were having chest pain, even at rest, I would have been able to do something about it." And then the final level is decision making. So what do I do with, again, do I, in the case of blood pressure, do I go on a low sodium diet? Do I start taking blood pressure medications? So some of those decisions are unilateral. I can make that decision myself. Some of those decisions are called shared decision making with your healthcare professional. So why did I go through this whole process? Well, you need that whole process. Not any one of those individual factors by themselves is enough to support behavior change. But if you work through that whole continuum from I know why this is important to now I know what to do about it, that's how you, in our minds, are able to change behavior and sustain that change.
Sri and Anil, would you like to also talk about your perspectives of behaviors and habits? I think Pat very well explained this aspect about how the patient should understand this. Any other perspectives that you would like to bring?
Well, I will have a slightly different view on this. I would guess, and there are studies about this also, 80 to 90% of the population know that doing physical activity, physical exercise is good for them. Almost the same percent, I would guess, know that eating more fruits and vegetables is good for them. Yet, they do not actually act upon it, right? So that also is a fact, and it's a behavioral issue. Nothing to do with information, nothing to do in terms of what is the known science behind it. It's just the personal behavior that is a roadblock to this. There was a study in Australia, I believe, that sort of like followed or asked or surveyed 6,000 obese people, and they said that, what is the impediment? Why do you not go for physical exercise or physical activity? And they cited three main reasons. One was that, they're not motivated enough. They're not disciplined enough. So that's a behavioral issue directly. Second, they were saying it's a discomfort, pain. I'm going to run on the treadmill or do some resistance weight training, right? There's a pain component to that. That's behavioral aspect of it. And the third most common reason cited in multiple such studies is this lack of time, right? And I think when presidents and the other people can find time to do the exercise, I'm sure all of us can actually find 30 minutes. That's what CDC suggests a day to do some physical activity. So I think that there is some fundamental behavioral component to this. And this has to do, I think there are other studies that talk about, if there was a short-term reward, then I think people will more likely to do it. But people do not tend to have the dilemma of 1 cookie now versus 2 cookies later. Very few people have that mindset of 2 cookies later, right? So I want to sort of not go to the gym, sit on the sofa and entertain myself with a new movie or a show is much easier. It's a reward is right there. It satisfies your desires and satisfies your entertainment quotient. But you're going to see your sort of improvement in glucose levels or lower blood pressure after 3 months if you continuously do so. So I think that's we got to really think about how do you tackle those kind of issues at scale.
If I can jump back in for a moment, I completely agree with Anil, and actually forgot about the final part of our model, which is you have to address the mental health aspect first, which is a lot of those barriers. Once you've addressed the mental health, you have to have a behavioral approach, something that is motivating. And once you've done that, then you can start providing more information and education. So I completely agree with what Anil's saying.
Yeah, Santosh, I mean, just for all the audience, I think I would highly recommend reading or listening to a book called Atomic Habits. So what we're talking about here is how can we make something a habit in our life, right? So that it doesn't feel like pain, it doesn't feel like discomfort, like Anil is talking about. What we are trying to do, and I think we all will agree that if we magically eliminated all other barriers, so no cost barrier, no accessibility barrier, no education barrier, everybody has access to all ample medications, monitoring tools. End of the day, it's going to be this ourself, our behavior that is inhibiting us, right? So I don't think anybody will argue about that. So what we are trying to do is how can we, can we do some things that doesn't even, bother anybody's mind? So for example, if I have a heart failure patient, I'm required to be taking my weight every day because I'm trying to detect fluid accumulation in my body to prevent hospitalization, okay? I know that we are very addicted to looking at televisions or smart screens, right? Can that smart screen look at our face and tell us that there is fluid accumulation in our body? So they're going about doing their stuff. They're not bothered to look, take their weight. So can we build solutions like that that does not make behavior an issue is where we are focusing on, right? That's an ultimate thing that I just said. We may not reach an ultimate state, but there are intermediate states. Today, if somebody is very disciplined, it's very painful for them. If they get on a weight scale, they have to maintain a spreadsheet of their weight and trends. Right? But can they just step on a scale or a BP cuff, which will automatically take their weight and graph it for them and tell them, hey, you need to pay more attention. It's increasing, decreasing. So Anil, telehealth already has solutions like this, right? So we are trying to look at how can we make some of those solutions even more accessible in a low resource setting, right? That's why I think behavior is the most important thing, and all of us are really trying to tackle that part of it.
I think all three of you touched upon, so sorry, Anil.
I was just going to say, so Shri, I think, you are absolutely right. I think the less effort on the patient side, the more compliance it will have, right? So there are technologies now. We are working with a company that actually trying to, get the blood glucose levels and the blood pressure through a smartwatch, which is not available today. There are multiple companies who are trying, none of them actually are FDA approved except for Omron. And I actually purchased this Omron watch. It's a $500 watch, a few weeks ago, but it is so bulky. And I compared that with the traditional cuff. It is not that accurate. Although it is FDA approved, that's the only one in the world, I believe, which is FDA approved smartwatch to monitor your blood pressure. So technology is actually getting there. It's just not there yet. But I think your vision, even then, you do not have to wear the watch. You get in front of your mirror, right? And I think there is a camera there in the morning. That's where I think it can detect whether there is kind of a loss of fluid or accumulation of fluid. That will be fantastic. And I think there are some things that people are talking about in terms of the floors having able to measure your weight. So I think there are certain newer technologies out there that can do some of the vision that you have.